Understood. And you won't hear me argue about the definition of OMPT. The paper definitely, I think, validates a lot of the training and different things you speak about. I guess my concern is we have, and I think manual therapy has undergone obviously sometimes a little bit inflammatory criticism. I get it, but I'm not a huge proponent. I don't think that really, but maybe it generates a conversation. But I get the historical perspective, and I can understand, like, we've had some giants, the Stanley Parises, the Maitlands, the Mackenzies, and we can name on some of the folks that I sometimes wonder, though, if we're not the prisoners stuck in Plato's cave, still staring at the shadows and seeing it through a kind of biased lens of manual therapy, when the research, to me, again, I won't say it doesn't show that manual therapy can't be helpful. I would question, is it been proven to be, and I don't think anybody argues with it, at least my OMPT buddies and fellow buddies, it's not necessarily, and it's been portrayed as it's probably part of a multimodal approach, yet we're trying to harness ourselves to define ourselves through a singular name of this multimodal approach. I guess my questions are, if we're so much more than manual therapy, to me, fellowship like surprised me on what I learned, because I honestly went in thinking I'm going to become a better manual therapist, because at the time I was thinking that was the definition of success. That was what was going to make me separate myself. We got so much more. The manual therapy was like the, I don't know, icing on the cake, or like it was so secondary to what the really meat of what we learned in fellowship was. Yet I still see, and I guess my big concern also is the public perception of physios who are coming up. And granted, they're living in a social media world where manual therapy, is getting criticized. And I think sometimes unfairly, I get it. It gets characterized. And I understand how we have to harness. In fact, here's what OMPT is. We're not going to lump ourselves in with the crazy stuff we see on social media. I get that. Yet I don't see the science to support that it needs to be such a defining characteristic. To me, a fellow can know when and what context hands-on care can be used, but also understand that it's one option of many that can be, doesn't have to be the primary for everybody, but definitely can be a hallmark of clinicians. Why the need to really come under to one intervention of what we know is so much more than that intervention of what we learn in fellowship training and what really defines an OMPT therapist, of what that definition is?